Welcome dear students, this is Dr. Pratyusha and our topic for this video is acute rhinitis. Let us study everything in detail about acute rhinitis. What is rhinitis? Before we study about acute or chronic or other types, it is inflammation of the nose. Inflammation of the nasal mucosa to be precise. So in rhinitis, there are various varieties and first let us talk about acute rhinitis. There are three broad causes for acute rhinitis and they are: first one, viral etiology. Second one is bacterial. And third one is irritative type. These are the three broad categories of acute rhinitis. Let us study all of them one by one. First one is viral rhinitis. In this, the first category is common cold, also known as coryza. Coryza, also known as common cold. The etiology of coryza is: we are studying it under viral heading. So mostly viruses are responsible for this and a few of them are adenovirus, picornavirus. In picornavirus, there are a few subtypes such as rhinovirus, Coxsackie virus, and another one is influenza virus. When it is caused by influenza, we call it influenzaal rhinitis. The rhinitis caused by influenza has a special name and that is called influenzaal rhinitis. As simple as that. So these are a few viruses. Adenovirus, which is a DNA virus, picornavirus is an RNA virus, and influenza virus is also an RNA virus. These are some of the viruses that cause common cold. The incubation period for common cold is 1 to 4 days. And the duration of illness is 2 to 3 weeks. Next, coming to the clinical features. The clinical features of common cold in fact need not be discussed because each one of you listening to the video, in fact every one of us must have experienced common cold at least once in a lifetime. It is almost impossible to not experience common cold. So the clinical features are obviously known to all of us, but still if we put it in a systematic order, first feature that is observed is a burning sensation in the nose. Burning sensation in the nose, and that too slightly at the back of the nose we experience, and this is a feature that we almost always ignore, and so it progresses. Next what happens is nasal stuffiness. Nasal stuffiness will definitely draw our attention because it causes difficulty in breathing and also it will change the voice of the person. stuffiness of the nose will change the vocal resonance. So voice will be changed, and also there is some difficulty in breathing. And the next stage is nasal discharge, the handkerchief stage. Now this nasal discharge also, initially it is watery and profuse. Then later on, if at all there is a secondary bacterial invasion, then it becomes mucopurulent. If there is secondary bacterial invasion. Initially watery and profuse. The viral nasal discharge is watery and profuse. Later on, there is a chance of it becoming mucopurulent if there is secondary bacterial invasion. Now let us learn what are the bacteria that can cause common cold after a virus. And to name a few, first in the list is pneumococcus, Streptococcus pneumoniae. It is a gram-positive cocci. Then Haemophilus influenza, gram-negative bacillus. And of course, our favorite bacteria which is present in all the lists, and that is Staphylococci. Then Klebsiella is also there. It is also a gram-negative bacilli like Haemophilus influenza. Moraxella cataralis, we say it is a gram-negative cocci. And a few other species of Streptococcus apart from Streptococcus pneumonia, Streptococcus hemolyticus, or a few other species. So these are a few bacteria that cause secondary invasion after a viral rhinitis, and then they convert the nasal discharge into mucopurulent discharge. Apart from this, other clinical features that are commonly observed are, there will of course be headache and also a low grade fever. Yes, and also some other general features like sneezing. Because of all the irritation in the nasal mucosa, sneezing can of course occur. So these are the clinical features. Next, coming to the treatment part of common cold. We are all very familiar with this also. Whatever we do, it almost always stays for a week at least, and sometimes for 2 weeks. But still, we would of course treat it by giving the patient plenty of fluids, antihistamines. Antihistamines will reduce the discharge. Nasal discharge will come down with antihistamines and nasal decongestants. They will cause vasoconstriction of the blood vessels in that area, and eventually the discharge will come down. Apart from this, the patient is also having headache and a low-grade fever, so we can give an analgesic. Something as basic as a paracetamol can be given. And if at all there is a secondary bacterial invasion, then we go for antibiotics. If there is secondary bacterial infection, only then we prescribe antibiotics. And common cold, as we all know, is usually a self-limiting condition. It will resolve upon itself in a few days. But sometimes, very rarely, it can go into complications. Although it's rare, but we need to know. What can it cause? Rhinitis always has a risk of causing sinusitis. Rhino, sinusitis usually go together. So sinusitis, it can go back into the nasopharynx, oropharynx, and it can cause pharyngitis. Infection can go behind. And if it goes into the oropharynx, it can cause tonsillitis as well. Further deep down, it can cause bronchitis and pneumonia also. I mean, very rare and bad complications, but they're possible. And so I think we have studied all possible directions. It can go up and cause frontal sinusitis or any other sinusitis. It can go behind. The infection can go behind and cause pharyngitis, tonsillitis, bronchitis, pneumonia. It can also go via the eustachian tube into the ear and cause otitis media. So this is about common cold, also known as coryza. I think it's more a topic for ourselves or for anybody rather than, the doctor-patient kind of thing. It's more like a self-treatment type of topic. Okay, next in our list of viral rhinitis is rhinitis associated with Exanthemas or Exanthematous fevers. What are Exanthematous fevers? Fevers with rash that are typically viral. For example, most common example is measles, chickenpox, rubella. All of these are Exanthematous fevers. They cause a fever with rash and they are all viral type. So in these fevers, sometimes rhinitis will precede the fever and the rash. So some of them, let me list out: Exanthematous fevers, measles, chickenpox, rubella. In all these conditions, rhinitis can or may precede other clinical features, may precede fever and rash. Now, why we have studied them separately is, sometimes in a patient of measles or any of these fevers, when we are taking the history of the patient, they usually begin by saying that it all started just with a common cold and then it has come this far. So this is a clue that in these fevers, sometimes they are all preceded by rhinitis. And why we must consider and note this point is, a common cold, as I earlier told, coryza, usually does not go into complications, but this rhinitis that is associated with exanthemas, it has more chances of going into complications. More chances of complications. The complications are more frequent and they are more severe type of complications. Next, let us learn about bacterial rhinitis. After viral rhinitis, next category is bacterial rhinitis. Bacterial rhinitis usually occurs in children and it is of two types: primary bacterial rhinitis and secondary bacterial rhinitis. Primary bacterial rhinitis occurs due to pneumococcus, streptococcus, and Staphylococcus. These are some of the common bacteria that cause primary bacterial rhinitis. And secondary bacterial rhinitis is nothing but a bacterial infection superinfecting a viral rhinitis. Bacteria supervenes viral rhinitis. Virus always invades and provides a fertile ground for bacteria to come and infect. So all viral diseases have a risk of secondary infection with bacteria. So what are the clinical features of bacterial rhinitis? A grayish membrane is formed in the nose. A grayish membrane in the nose is seen. Where exactly in the nose? Usually at the level of the inferior turbinate. And this membrane bleeds upon an attempt to be removed. Bleeds upon removal. So this is about bacterial rhinitis. But under bacterial rhinitis, we have a special category called as diphtheric rhinitis. Caused by Corynebacterium diphtheria. Now, special features about this are, first, it is very rare. Diphtheria usually causes something in the throat, pharyngeal diphtheria. It's more of a oropharynx area causing disease causing bacteria. But rarely it can cause rhinitis. And this is of two types. Primarily itself it can affect the nose, or secondarily first there is pharyngeal diphtheria and from there it has spread into the nose and it is causing diphtheric rhinitis. So primary diphtheric rhinitis is one variety. Secondary diphtheric rhinitis from a pharyngeal primary diphtheria. Both of them are possible. And this diphtheric rhinitis could be acute or chronic. Here also there is a grayish membrane. A grayish membrane that covers the inferior turbinate and the floor of the nose. An additional feature that we see in diphtheric rhinitis is there is excoriation of the skin of anterior nares and upper lip. All this area there is excoriation of skin. It happens in common cold also if we use a very rough kind of cloth to clean the nasal discharge, and usually in children where the skin is very sensitive, excoriations in that area are seen, but it is a special feature of diphtheric rhinitis. Now, treatment for diphtheric rhinitis is important. Although until now whatever you have seen, it is very similar to any other general type of bacterial rhinitis, but treatment is important because for a normal bacterial rhinitis, giving antibiotics and some other supportive treatment would suffice. But for diphtheric rhinitis, we must isolate the patient. because it is highly contagious and it can spread from one child to another child, and it can also cause some complications. So isolating the patient is very important. Isolate the patient. In second, give antitoxin. Diphtheria antitoxin has to be given. Apart from that, antibiotic that we use is penicillin. These three measures have to be taken for diphtheric rhinitis. And of course, the supportive measures for any type of common cold is adequate amount of rest, plenty of fluids, some steaming, analgesics. All supportive measures have to be given for diphtheric rhinitis also. Next, last variety is irritative rhinitis. Under acute, we have viral, bacterial and irritative rhinitis. So what is irritative rhinitis? There are some irritant substances in general, such as dust, smoke, or some irritating gases, such as ammonia, formalin, and some acid fumes. All of these are irritative substances, but in some people they can cause a catarrhal reaction immediately when they are exposed to these substances. There occurs an immediate reaction of sneezing, catarrhal nasal discharge, nasal congestion. All of these occur in certain people. We must have all had at least one friend in MBBS first year. When they are exposed to formalin in the anatomy dissection lab, they would have immediately started sneezing and had their nose running and eyes watering. Yes, that is irritative rhinitis. Irritant substances in some people, they cause an immediate catarrhal reaction, nasal congestion, sneezing, nasal discharge. But the nice thing about irritative rhinitis is it usually resolves upon eliminating, when you come out of that offending substance, upon removal of the offending agent. But sometimes the nasal epithelium is damaged during this exposure itself. If the exposure is very intense or the person has already having some other damage, then the nasal epithelium can get damaged, and if the nasal epithelium is damaged, then these symptoms take time to resolve. Sometimes nasal epithelium is damaged, and if nasal epithelium is damaged, then symptoms resolve only after that epithelium regenerates, and that might take about 1 to 3 weeks. So based on this, that clinical features phase may pass off immediately or it may persist for 1 to 3 weeks depending upon the nasal epithelium damage. So this is about irritative rhinitis. So these are the 3 varieties of acute rhinitis. Let me quickly summarize all of them for you. First is viral rhinitis, also known as coryza or common cold. And the common viruses causing them are adenovirus, picornavirus, which includes subcategories of rhinovirus and Coxsackie virus. And if it is caused by influenza virus, we call it influenzaal rhinitis. And the incubation period is 1 to 4 days and it usually lasts for 2 to 3 weeks. Clinical features are burning sensation in the nose, nasal stuffiness, nasal discharge, which is initially watery and profuse. But later, if there is secondary bacterial invasion, it can become mucopurulent. And some bacteria that can cause secondary bacterial infection are pneumococcus, H. influenza, staphylococci, Klebsiella, moraxella, and streptococcus. Apart from that, there are some general features such as headache and a low-grade fever, and also sneezing. And we treat it by giving plenty of fluids, antihistamines, nasal decongestants, analgesics for pain relievement. And if there is secondary bacterial infection, antibiotics have to be given. And rarely it can get into complications such as sinusitis, pharyngitis, tonsillitis, otitis media, and even more rare are bronchitis and pneumonia. Then second is rhinitis associated with exanthematous fevers. Fevers such as measles, rubella and chickenpox might sometimes be preceded by a rhinitis. And what is important here is in these type of fevers, this rhinitis has a higher chance of getting into complications. More frequency and more severity of complications can occur. Next, we have bacterial rhinitis. Primary bacterial rhinitis can be caused by pneumococcus, streptococcus and staphylococcus, and a secondary bacterial infection is nothing but a bacterial infection that is preceded by a viral infection. Viral rhinitis supervened by bacteria. In bacterial rhinitis, a grayish membrane is formed, a tenacious membrane is formed in the nose, but if we try to remove that membrane, it causes bleeding. Diphtheria rhinitis, diphtheric rhinitis is a special variant under bacteria and it is very rare, but if it occurs, it can either be a primary diphtheric rhinitis or a secondary diphtheric rhinitis, that is a diphtheria that has started normally as a fascial diphtheria that later spreads into the nose and causes diphtheric rhinitis, and this can be acute or chronic. And in diphtheric rhinitis also we have a grayish membrane that is covering the inferior turbinate and floor of the nose. An excoriation of the skin of anterior nares and upper lip can occur. Treatment is by isolating the patient. This is very important in diphtheric rhinitis. An antitoxin of diphtheria has to be given along with antibiotic. Last under acute rhinitis is irritative rhinitis, which is very simple because of some irritant substances like dust, smoke, some gases such as ammonia, formalin and acid fumes. The patient can have sneezing, catarrhal nasal discharge and nasal congestion. And these symptoms usually resolve upon removal of the offending agent, but sometimes if at all the nasal mucosal epithelium is damaged, then the symptoms persist until the epithelium is regenerated. So this is all about rhinitis. Thank you very much.